Hello, my name is Mason, and I will be giving a presentation on drugs that fall under the category of central nervous system depressants. This is going to be a complete guide, all the information you'll need to know, and kind of generally what these drugs are like. So, what are central nervous system depressants? Well, according to the National Cancer Institute, they're a type of drug that slows down brain activity, which causes the muscles to relax and calms and soothes the person. So, there's different types of CNS depressants, but some major differences between the types are the dependent upon safety and how addictive they are. So some can be a little more useful in for medical use. Some are have a greater health risk and can be detrimental to someone's health if they overuse it. Some are more addictive, and some of them have different actions and effects than others. So the first type I'll be going over are benzodiazepines. They're used for mainly anxiety, sleep, muscle relaxation, and to counteract seizures. They are habit forming with the potential of abuse and withdrawal. So some of the side effects are drowsiness, lethargy, lightheadedness, nausea, skin rashes, reduced libido, and menstrual irregulations. So these drugs, some fun facts is that in 2021, about 14% of opioid overdose deaths were also involved with these. Um, so overdose deaths are rare with just these drugs, but combining them with these drugs, then or these drugs with alcohol or opioids, it can lead to death more common. So some common types listed here are listed here. Xanax being one of them, a big drug within college students, especially raves and parties. Um, yeah, so just be very careful when mixing those with alcohol. So another type, I'd say one of the major categories, um, alongside the benzodiazepines, are barbiturates. So barbiturates are derivatives of barbaric acid. They're used medically as sedatives and hypnotics. They were used more before, but then they've been kind of replaced by benzodiazepines because of safety issues. So some common uses is to treat epilepsy, seizures, and they're used as an anesthesia during surgery. So some common examples are listed below. Some street names are barbs, downers, rainbows, goofballs, yellow jackets. The effects of the body and mind are listed on the right. These are going to be generally kind of what someone could experience when taking these, like double vision, slurred speech, lost coordination, drowsiness, dizziness. It can also, in your head, in your mind, cause anxiety or even relaxation, euphoria. So it just depends on how you use the drug. So another type is chloral hydrate. It is a CNS depressant and hypnotic, so meaning it's sleep inducing. It's known as a knockout drops or Mickey Finn drink, and this is because it's notorious for being secretly added to drinks to cause unconsciousness. Some side effects: stomach irritant, causes tolerance and physical dependence, and yeah, just mainly used to put people to sleep. And it's very easy to overdose on. And so the last category I'll go over is amphetamines. They're used mostly and should be used for prescription over the counter. It's to treat allergies. So these are going to be like Claritin and any allergy pills you take, or most of them. They do block acetylcholine receptors in the brain, and it causes relaxation and sedation. And so some key takeaways is the effects on the body, like a slower brain, nervous system activity, cause of relaxation, calmness, drowsiness, reduce heart rate, breathing rate, blood pressure, and it can lead to dependence. And some risks is addiction, physical dependence, and combining it with other drugs, which can really increase your risk of overdose. It can also cause, in excessive use, memory loss and mood changes and poor concentration. And withdrawal can lead to anxiety, tremors, and seizures. So be careful. But overall, thank you for listening, and here are my references listed. Thank you. Bye-bye.